Welcome to AGB Pharmacy channel. Today we'll be talking about hypertension. Now, what is hypertension? Hypertension is a chronic condition where the blood pressure persistently stays above 140/90 millimeters mercury. The normal blood pressure range should be between 120 to 139 over 80 to 90 millimeters mercury. But when it stays persistently above that value, then there is a problem. Hypertension could be caused by so many factors, which we will look at in the course of this video. And the important thing to note is that when the blood pressure stays persistently high, it will cause damage to organs like the kidney, the heart, even the brain. Now, in most cases, hypertension may have no symptoms. It is called a silent killer. Because you could just say Mr. A just fell down and collapsed. When the cause of the collapse is looked into, you find out that his blood pressure was sometimes very, very high. So let's look at some of the causes of hypertension. Like I said earlier, hypertension could be as a result of so many factors. The first one is genetics. Cases. Children from parents that suffered from hypertension likely do develop hypertension in the course of their life. Stress and poor sleep. Lack of proper sleep for the body to rest and recover leads to hypertension over time. Lifestyle. Lifestyle habits like taking too much salt predisposes more to hypertension. And also factors like body size, like weight. People with high weight, high body mass index, stand a bigger chance to come down with hypertension. So let's look at the symptoms of hypertension. It is important to note that hypertension actually has no symptoms. But in some cases, the patient could experience headache, dizziness, sometimes blood vision, sometimes chest pain could show up. Then, over time, in the long term, hypertension has the danger of leading to organ failures like kidney failure, heart failure, stroke. These are some of the likely damages that hypertension could cause over time. So let's look at how we can prevent hypertension. If we take these measures, it will go a long way in preventing us from developing hypertension. Eat more fruits and vegetables. Avoid processed foods. Exercise regularly. Quit smoking and eat less of salt. So when the blood pressure becomes high, there are medications and steps we use to manage it in the pharmacy. Now we have different classes of drugs used to manage hypertension. And depending on the stage of the hypertension, there are drugs that are suitable. Examples are the calcium channel blockers like the amlodipine, nifedipine. We have the angiotensin converting enzyme inhibitors. We have the diuretics, which work by removing water from the body. And other classes of medications we use in the management of hypertension. It is important to always take your medication once prescribed, except you are advised differently by your doctor. Hypertension does not have to steal lives. With regular checks, healthy lifestyle, and proper medications, you can live your life very healthy, fully. Subscribe to the channel and like our page so you can keep seeing our future videos.